My name is Tina Crook. I live in Coolidge, West Virginia. When Dalen was 13 years old, he was diagnosed with HSV type 1 encephalitis, which is the common cold sore virus. Instead of getting a cold sore, it somehow traveled into the brain and caused mass infection, which left him with some permanent left frontal lobe brain damage. The pediatric care was good. We moved from like the more central part of West Virginia down to the southern part, and we had to get new neurologists and doctors whenever we moved. That transition, just changing doctors went pretty smooth. The neurologist that we had been seeing put in a referral to one that was more down south. They were really good. They really listened and took their time with Dalen, reviewed all of his charts so they knew kind of what they were getting into from day one with him. The transition from pediatric to adult care for Dalen did not go smoothly. When Dalen was 18, we went for just our regular 6-month checkup, and he said, this will be the last time that we see you, and didn't do a referral on to nobody else. And we were, kind of panicky, like, oh gosh, we need a neurologist. It was a 6-month wait to get in to an adult neurologist. None of Dalen's medical records were transferred to the new neurologist. It was also during COVID. They wouldn't let me go in with him. As far as all the deficits and stuff, he's not real good about explaining that or medication. He can't remember what medications he was taking. By the end of the appointment, they were both frustrated with each other. Dalen walked out with no refills for his medication and no new appointment scheduled.
They might have 5 providers that they see. Plus their primary care provider. That difficulty with transition is that they have to see new providers. One of the recommendations I make to families is that you don't want to transition all at once, everybody. You either stay with your pediatric provider as you go through those transitions, or transition into a new adult provider, get to know that person. They get information from the pediatric provider and then make the transition into the individual adult specialty people.
All of the responsibility for the transition was put on Dalen and I. I feel like one of the biggest things that people could take away from this is to just, take a look at his. It didn't go smoothly. Had the pediatric neurologist made that referral for us, sent those records, took a few minutes and called that adult neurologist, months down the road to say, hey, I'm just checking on this patient that I referred. Did they make it to their appointment? Do you have any questions for me? Had he not been able to communicate with them how he was feeling, he may not be with us today because they might not have, known to, let's try this mood stabilizer, let's try this. I think that could really make a big impact as far as transitioning from pediatric to adult health care.
Hi, my name is Anna Smith. I'm from Belleville, West Virginia. When I was in the hospital, I was very sick at the beginning, but my mom talked to the doctors because she's my medical power of attorney. After I was feeling better, the doctors and nurses talked to me. I want doctors to talk to me and ask me questions, not other people in the room. Sometimes I make a list of things I need to tell them about, read it when I get there. I put my appointments in my phone calendar so I know when I have one coming up. I get on my chart and look up the dates. I read my test results and send a message to my doctor. I was scared the first time because I didn't know half my doctors. But as you get to know them, they get really nice and they care about you, about what you're doing. I want to live on my own someday, so I need to be able to speak up for myself. I need people to understand that I can take part of making decisions that will impact my life and health. I want to be here in the world because I want people to know me and love me for who I am.
I have a 19-year-old daughter, Gracie. Gracie just happens to have Down syndrome. So right now we are working on transitioning to adult health care. It's just been really scary, I guess. We've had the same physicians for the last 19 years, so it's uncharted territory. What I say to all families that have children with disabilities when we're talking about transition is to start early. It doesn't matter if we're talking about education or if we're talking about medical care. Don't be afraid to ask questions when you do talk to doctors. One of the things that I educated myself on, again, was turning 18 and everything that entails, applying for Social Security, looking at what our options were as far as guardianship and alternatives to guardianship. I think the thing that scares me the most about transition is making sure that physicians see her for her and don't discount because she has a developmental disability, that her life doesn't matter as much as someone that doesn't have a disability. We want someone that will talk to Gracie, but will talk to me as well.
Hello, my name is Robin Hatcher. I'm from Flat Top, West Virginia, and I want to introduce you to our little blessing. Her name is Haley Hatcher. She is 20 years old, and Haley has Down syndrome. She has severe cerebral palsy. She has something called periventricular leukomalacia, which a significant part of the brain was damaged at birth, which ended up giving her cortical blindness. She also has chronic lung disease and a host of other secondary diagnoses. Within her environment, it's very much like a little mini ICU unit.
I came to be caring for Haley about 1.5 years ago. I was contacted through one of the local hospice nurses who reached out to me because Haley was aging out of pediatric care. Her primary care pediatrician needed to transition her to an adult physician. It was very helpful from the standpoint of my initial contact with the Hatchers that they knew what they were doing. They had a long track record of taking care of Haley. They had a pediatrician who was willing to be available if I had questions. It's always a stressful event to deal with any kind of change, and particularly in a scenario such as this, and then for someone new to step in and try to assume that role, there has to be some time period for that relationship to gel, so to speak, for the physician to be comfortable with what the family members are saying and for the family members to be comfortable that the physician knows what they're doing.
The reason it's so stressful in transitioning is because you have a very complex patient. And I'm sort of a take charge type person. I don't like to sit on things. So as soon as I saw her approaching age 18, I'm the one who pursued the pediatrician, and I had a conversation with him. And he understood, and I will tell you, this is not a man that I would have ever wanted to leave. We had a great working relationship. I asked him, did he know of any physicians that he thought would be good, and he said, let me think about it. But in the meantime, we did have hospice in the picture. Haley qualified for like a palliative care, and these are people who were coming in constantly on a weekly basis. They got to know me and Haley and what our needs were and how complex that she was, and that traveling with her is extremely difficult. So they recommended a doctor that they use to see patients in the area who will travel and see the patients. So that was our connection with Dr. Shorter. He has been a blessing to us. He really came in and I feel like he worked with the pediatrician well, getting the overall history, working with myself to understand, this is really what this is going to look like as far as her daily care, what we do yearly. We've been in this for about 1.5 years now, and I feel like we have a great rapport with one another. And I've gained that respect from him, which is definitely needed. He needed to understand who we were, and we needed to understand who he was.
We meet together at Haley's home every 3 months or so, just so I can get a general sense of how she's doing, and to be brought up to speed by Haley's mother, who is very attentive and probably could passed her boards as a critical care nurse at this point. She really has a very firm idea of what's going on with her daughter.
The number one thing I learned over the years is always listen to the families. You may think you know about what it is, whatever your expertise is, but you don't have near the expertise that families have, expertise about their own kids.
Once you start to see Haley as a person, you're gonna start caring about her like I do. You're gonna start seeing who she really is as a person. This is the person that I'll fight to the death for, that I really care about. And one of the things is just seeing her smile, seeing her interact with you, seeing her listen to a video that she loves or me to sing a song and how she lights up. She's really a real human being that once you see the whole person, I think that's going to help you in really providing her care.
She's living her life, and my job is to help her live that life to its optimum.